One of the top cancer centers for mesothelioma in the United States is the MD Anderson Cancer Center in Houston, Texas. MD Anderson is a world leader in cancer research, treatment, and prevention. Their mesothelioma specialists have extensive experience treating this rare form of cancer, and they are involved in many clinical trials evaluating new treatment options. At MD Anderson, mesothelioma patients have access to an entire team of experts including thoracic surgeons, medical oncologists, radiation oncologists, nurses, and other support staff. The surgeons at MD Anderson have pioneered innovative surgical procedures to remove mesothelioma tumors from the lining of the lungs, heart, or abdomen. They also offer complex multimodality treatments combining surgery with chemotherapy, radiation therapy, or immunotherapy depending on the individual patient's diagnosis and prognosis. When it comes to mesothelioma chemotherapy, MD Anderson's medical oncologists are experienced in administering all the FDA-approved drugs for mesothelioma including pemetrexed, cisplatin, raltetrexed, and others. They thoroughly review each patient's case to design a customized chemotherapy regimen. Patients enrolled in a clinical trial may have access to investigational drugs that could represent the latest advances in treatment. MD Anderson also utilizes cutting-edge radiation therapy techniques such as intensity-modulated radiation therapy, IMRT, for mesothelioma. In addition to its renowned medical team and facilities, MD Anderson has several resources to support mesothelioma patients coping with the emotional and practical challenges of a cancer diagnosis. This includes social workers, nutritionists, therapists, support groups, financial advisors, integrative medicine specialists, and more. Patients can take advantage of MD Anderson's pastoral care services, art and music therapy, exercise and meditation classes, or just meet others experiencing similar struggles. Another excellent option for mesothelioma treatment is the University of Texas Southwestern Simmons Cancer Center in Dallas. UT Southwestern's multidisciplinary thoracic oncology team has decades of experience specifically in asbestos-related cancers like mesothelioma. Their goal is to offer every patient an individualized, coordinated treatment plan based on the latest medical evidence and ongoing clinical trials. UT Southwestern's thoracic surgeons are experts at removing mesothelioma tumors utilizing minimally invasive surgery techniques when possible to reduce recovery time and post-operative complications. The Simmons Cancer Center is also an international leader in photodynamic therapy, PDT, a light-based treatment that can potentially eliminate residual mesothelioma cells after surgery. For patients whose cancer has metastasized or recurred, UT Southwestern's medical oncologists prescribe cutting-edge systemic therapies. In addition to standard chemotherapy regimens, UT Southwestern participates in immunotherapy clinical trials that could one day change the paradigm for mesothelioma treatment. Immunotherapy boosts the body's natural defenses by training the immune system to recognize and target cancer cells for destruction. The Simmons Cancer Center maintains an ongoing immunotherapy research program focused on mesothelioma and other thoracic malignancies. Like at MD Anderson, patients at UT Southwestern's Cancer Center have access to a comprehensive team of experts, support staff, and resources to address all their medical, practical, and emotional needs. This includes genetic counseling, symptom management, nutrition guidance, integrative therapies, and more. UT Southwestern is also involved in important mesothelioma research and clinical trials evaluating new biomarkers, drug combinations, and investigative agents that may lead to more effective treatments and a better prognosis in the years to come. A third note for the option for mesothelioma care located in the Midwest is the University of Chicago Medicine Comprehensive Cancer Center. Their thoracic oncology team works closely with experts from all relevant disciplines including medical oncology, radiation oncology, thoracic surgery, pulmonology, pathology, and more. University of Chicago Medicine's thoracic surgeons are among the nation's leaders in minimally invasive procedures for mesothelioma patients, reducing recovery times. At University of Chicago Medicine, Patients have access to the latest treatment approaches including multimodality therapy, systematic neoadjuvant, adjuvant chemotherapy, extrapleural pneumonectomy, pleurectomy, decortication surgery and more. Like other top cancer centers, they are actively involved in immunotherapy and targeted therapy clinical trials for mesothelioma that may lead to breakthroughs. Their medical oncologists stay on the cutting edge of systemic regimens for both initial and recurrent disease. University of Chicago Medicine's Comprehensive Cancer Center provides psychological and social support as well through counseling, support groups, recreational therapy, nutrition guidance and more programs to address the whole patient. Their genetics program helps determine inherited cancer risks and family screening needs. Advanced palliative and hospice care is also available for patients with advanced mesothelioma. For mesothelioma patients seeking top-level, coordinated care from experienced specialists, MD Anderson Cancer Center, Utah Southwestern Simmons Cancer Center and University of Chicago Medicine are three nationally ranked cancer centers well-equipped to treat this aggressive cancer. All offer access to multimodality therapies, expert surgeons, ongoing research and clinical trials for the latest treatment approaches, and comprehensive support services to address every aspect of care for the patient.